Hello, everyone. This is Mary Kurek with Frontrunners Innovate, and I am just thrilled to introduce to you Priyansh Shah. And Priyansh is interning as a doctor in India in cardiac space. And but before we get into that, what he's doing is what got my attention is he's the founder of the World Youth Heart Federation. And so we do want to talk about how he's working with youth and when this whole effort started. You can't have enough youth in medicine and in the types of work that you're doing, Priyansh. And so we just, first of all, praise to you for all that you're doing there. But he, as I told him before we got on record, now that you've stepped in the leadership spotlight, but becoming a founder of an organization that does good, then you've got our attention, and we want to let everybody know what it is that you're doing and then see how we can kind of connect you forward. So let's start with getting to know you a little bit. So feel free to introduce yourself by way of your background, what brought you into what you're doing. Okay.
For sure. Thank you so much for the wonderful introduction. I'm really glad to be here, and I would really like to congratulate you for all the connections you've made in the past and the effort of making more connections in the future. SDG 17 is the way to go.
It is.
So to begin with, I'd say that I think my interest in medicine began when I was in I'd say 9th or 10th grade. In my 11th grade, I lost my grandmother due to sudden cardiac death, and just 1 year later, when I was in my 12th grade, I lost my grandfather due to a heart attack. And that was much more traumatic for me because I actually saw him lie on the ground. I gave CPR to him, and by the time we reached the hospital, he couldn't make it. And then I entered medical school. And when I entered medical school, I just realized that this problem is, so I felt that it's something which runs in my family, and heart disease is something really bad. So, and once I entered medicine, I understood that it's a global pandemic. The numbers of NCDs are rising, and almost 17.9 million people die because of cardiovascular diseases each year. That's like the highest number of deaths due to any particular disease. So that just, put more interest towards this field. And in my third year of med school, I joined an organization for medical students where I served as the National Officer for Public Health. So that actually introduced me to the impact that we can make via public health projects and campaigns.
Yeah.
And in medical school, while you're doing clinical practice, you learn how to treat an individual patient. But when we're looking at things from public health perspective, we're looking at the masses, and we're looking how we can prevent diseases in so many people. So with that, we launched multiple campaigns. After that, I was also part of, I served as a vice president for finance at a global surgery organization called Incision. And I also organized the first digital pre-WHA. So it's the youth event which takes place before the World Health Assembly every year.
Oh.
So it's organized by IFMSA, which is International Federation of Medical Students Association. So I was one of the organizers of that event, and unfortunately we couldn't fly to Geneva because of the COVID wave. But we at least held it online and made it possible. And this brings me to the World Youth Heart Federation. So after this, during the pandemic, when I was in my final year, I was sitting at home, and I'm that kind of a person who comes up with ideas every now and then. I come up with a new idea, I run to my father and, say that, I think there's a business opportunity here, or there's something good we can do here. And he just asked me to Google it and, probably give a few references, and it's already there. So that's how that's how I work. And I had a lot of these ideas, in my notebook. And during COVID, when, all our classes were shut or everything was closed, I had developed the idea of World Youth Heart Federation. So what we're aiming at WIHF is promoting intersectoral collaboration, because we feel that a lot of major health organizations, they're mainly doctor-centric. And today we know that we cannot tackle any disease with only medical knowledge, but we need a lot of aspects to it from different professional backgrounds. So for that, we started WHF with 5 working committees, and they go with the acronym of HEART. So ED stands for health education, then entrepreneurship, advocacy, research, and technology. So up till now, we've worked in a lot of healthcare NGOs, which work on advocacy, research, and education, but few of them work on technology and entrepreneurship. So this is something new that we're trying. And on the WHF, we started off in March 2020. So it's almost been 2 years now.
Yeah, I was going to ask you when you started this. Yeah.
Yeah.
So that really was towards the end of you had one more year to finish because you just graduated from med school. Yeah.
Yeah.
Wow.
Yeah.
Okay.
So, and that's supposed to be the toughest year, but because of COVID, we didn't have a. And I came up with this during that year, so it was something great, I'd say. We did a lot of amazing stuff with it. So towards the end of the first year, we organized our first annual conference called the Heartbeat, where we organized one of the first and the largest digital biodesign workshop specifically focused on cardiovascular health. So here in biodesign, we brought in people from technology and we brought in people from healthcare, and how we can simplify innovation. It was a workshop on that, and it saw, I think, over 2,000 participants had attended that event. And yeah, so that was towards the end of the first year, and we just began working on our efforts when the second wave hit, which was much worse than the first wave. So currently, we have a network in India where we have an outreach of over 15 to 20,000 people across India and over 600 members. And most of us are from the medical background. So what we observed during the second wave was we felt that we had to halt all our efforts and we had to focus on COVID. So we devoted all our efforts towards COVID relief, and we made a huge impact during that time, I could say. So we initially started off with a helpline, which worked well. We then later developed an application, which was a first step further than a helpline to help patients connect in the rural areas. And then what we were observing, so I'd worked in the COVID ICU for almost a month, and we used to watch patients die so we had 8-hour duties, and in our 8-hour duties in an ICU, we used to see almost in a room with almost 40 beds, almost 6 to 8 people died every day. So it was that bad during, yeah. And it feels so bad that, you wake up, the next day you go for your duty and the person you were talking to yesterday, and you just started talking to it, they aren't there anymore. And people also were so frustrated that, they don't want to live. They were like, get the mask off me and all of that. So, but jumping out from that, what we observed that particularly in our hospital, we had a shortage of a medicine called heparin. So heparin is, it's used to bust blood clots. And a lot of patients during COVID died due to a thing called pulmonary embolism. So we needed heparin for that. And a lot of times we didn't have it in our government supplies. So we had to ask the patients to get it. And sometimes the patient weren't even able to afford that medicine. So the people used to die because of preventable medicine deficits. So that's when we identified that the need is not only the hyped up oxygen concentrator, which was showcased everywhere, but on ground there were a lot of other supplies which were lacking here and there. So we started with Local Heroes project, wherein we had 3 steps. So it was a hyperlocal model project wherein we identified the needs. People at the hospital used to identify the needs. Then they used to assess manufacturers and sources from where they could get those supplies. And then they used to raise funds locally. We also tried a couple of national fundraisers, but what we observed was people at the local level felt much more towards helping out their own local community. So I'd say that initially when we started the national campaign, the national fundraising campaign, we raised around 50 to 70,000 rupees in the national campaign. But when we moved on to this hyper-local model, across India, we worked in over 58 cities in all the states of India. And we were able to, provide targeted supplies worth almost 25 lakh rupees across India. And that impacted over 4 lakh patients and frontline workers across India. So
Wow.
that was something.
Yeah.
Thank you so much.
Mm-hmm.
So that was.
Oh, we froze up. See if we can get him back. Priyansh, you've frozen up. So my guess is I might have frozen up on your side. This happens periodically. Let's see if we can get ourselves back. Patience, everyone. Now, this is what happens when we are talking with people from far away. So we're going to give him a second. Here he comes back. Let's see if this helps. Here we go. You back?
Yeah,
yes.
I'm so
okay.
sorry.
Yeah, you froze up. So I've told everybody be patient. Yeah. So, well, let's go forward from where you're at. I mean, my goodness, this is fantastic. People lots older than you with lots more experience that haven't even accomplished nearly this much. So this is just saving lives is important all by itself, but the way that you're going about it is basically that whole number 17 we talked about, the partnerships, is bringing so many people together to accomplish the common goal. So talk to me about, where you're now. We know a little bit about what you've been doing with the organization. Talk to me about what's coming up, what's happening now, and how are you moving forward this year with it, now that you're out of med school and you interning as a doctor in a hospital there. So talk to us a little bit about going forward.
For sure. So just before the pandemic, we planned to work on strengthening the rural areas. And during the pandemic, we understood the lack of resources there. So the current project that we're working on is strengthening the rural healthcare system under Project Cardiogram, when cardio means heart and gram means village in Hindi. So so this is a project that we've started off, and we've been working on it since July. We've come up with the framework based on a hub and spoke model, wherein we're placing digital ECG machines at rural primary and community health centers and connecting them with the hubs in the cities, which are big hospitals which have emergency cardiac facilities. So these hospitals, they're able to respond to the ECGs which are recorded in the villages via telemedicine applications. And this will in turn reduce the time. So usually what happens in a acute condition like a heart attack, that if the patient's able to reach a bigger hospital within 1 hour, the chances of survival are like over 80 to 90%. That's called the golden hour in a heart. So if we're able to reduce that time span, so that is one thing which we're aiming at. And secondly, most of the people in those villages, they've not done any of their routine checkups. Most of them wouldn't even have done their blood pressure measurement. So we're also, having a lot of mass screening camps at those places to have a full NCD screening camp, wherein we're screening for non-communicable diseases like diabetes, cardiovascular diseases, and a couple of cancers if required. So that is where we're going. Currently, where we are at with that is we've developed a model system, a working model of this in Gujarat, and we've recently bought 52 digital ECG machines, and we're in the process of deploying these machines and setting it up. And once deployed, they would give access to 1.29 million rural inhabitants to cardiovascular care. So every primary healthcare center caters to a population of 30 to 50,000 people. So when we'd be deploying these machines, we'd be there. But what problem that we're facing, and where next partnership that we're looking at is the acceptance rate at all of these villages is still quite low, because using digital technology and having they might not even have the human resource for it. So what we're trying to work on next is having local champions. So probably helping the local villagers by education, or maybe food or some other way, in return of the work that they're given at the hospital. So with that, we might be able to benefit a family's education, or we can say livelihood. And they can also work diligently on this at the hospital. Mm-hmm. So this is one area that we're currently exploring. And so this is our flagship project. Under each of our working committees, we're working on various projects. So for example, I'll start with health education. So in health education, what we're currently working on I'd say a program wherein I'd say in the last 1 year, a lot of young people in Bollywood and I'd say famous people have died because of sudden cardiac deaths. Mm-hmm. So that is something which is very preventable, and that usually takes place when a person is exerted, either mentally, emotionally, or physically. Mm. So we're trying to begin a program for gyms wherein we'd give them a training on emergency cardiac care, and we'll connect them to the nearby hospital. So in case a person has any problem while they're exercising, they're able to quickly take action. And I'd say, unlike a lot of places, I'd say in Europe and US, they do have AED machines at gyms and some public places. We don't have those AED machines in India because they're very expensive to, keep in such small places, and most of the people don't even know how to use them. Yeah. So we're trying to fill that gap with education, and also working on various multilingual educational projects for patients, wherein we make a few videos and circulate it for patients' information. Then in entrepreneurship, we're planning to organize a hackathon probably by this fall. Okay. And in this hackathon, we're planning to, after the hackathon, the winners, we're planning to accelerate top 3 to 5 winners with their projects. So that is the big thing, and it'll obviously involve the biodesign workshops. It'll be like a full workshop when they're trained on how to begin a startup, and then how they could go ahead with it. So that's an entrepreneurship. In advocacy, India recently started the National Digital Health Mission, wherein they're trying to digitize health. Mm-hmm. So we're planning to advocate for the involvement of youth and taking up digital health at a larger scale in hospitals, in advocacy, and working on policy documents and all of those things. Mm-hmm. In research, we're working on mentorship mentee network, and we're going to work on large scale multi-centric research projects. One of the flagship research project that we're planning to start since a couple of years, but haven't been able to do so because of COVID, is the blood pressure study. Mm-hmm. So India has one of the highest number of people with high blood pressure. Mm-hmm. And our blood pressure guidelines are usually adopted from either European Society of Cardiology or somewhere else. Mm-hmm. So it's not based on the research done on the Indian population. So we still lack
that research. Not on exactly all of the above, genetics and everything.
Exactly, because genetics is so important in this, and our lifestyle, our culture, so many things adds on to it. So we're planning to work on this research study, but once we have a little lower COVID restrictions, we would probably be able to go ahead with this. But that's one of the flagship research projects we're planning to begin with.
Wow,
And
you are one busy fella. So talk to us about the book you mentioned to me a while ago that you've
yeah.
Yeah.
So currently I'm also writing a chapter in a book on telemedicine, which is being authored by Dr. Amir Bhatt and Dr. Andrew Freeman. Mm-hmm. And in that chapter, I'm talking about our experiences of Project Cardiogram. So how we've been implementing telemedicine in India, and what obstacles we're facing, what are the lessons we're learning, and what people could take care of when they're trying to implement it in the rural areas. Because I'd say we've worked for over 8 months, and I think we still have almost 7 to 8 months before I could say we have a very solid working system. Because every time you have something set up, you face a problem. And these are the problems you cannot identify at a theoretical level. So it's only when you're implementing it, you understand what are the problems you're facing. So that's, and I think added on to that, I'd say one thing we're looking forward to and we're trying to actively work on is an application. So we're to connect all of these, we're trying to work on a web application, but we are still struggling for developing the web application, because it's so difficult to catch hold of proper, have a team on the web application side and get working in that area. So we have I'd say a low fidelity mocks for the website ready, but we're still waiting to implement it. So I'd say that is one of the biggest areas where we would require some collaboration and help.
Okay.
So
you've been identifying all along. You knew I was going to ask you about partners at some point, but you've been identifying some. But before we get to that, tell me, you named this the world. In the very beginning, the first word in your organization's title is world. And I've heard a lot about India, but I can see that you're there. And so you know about the problems and what you're experiencing there. So basically the seed gets planted there. Where do you see this going around the world? How do you incorporate the world in what you're doing?
For sure. So I think that's I'd say that's the next temporal event in our plan. And currently, so just a little background on this, the organization. So our organization is registered as a Section 8 company, which is a type of NGO, but has a structure of a private limited company. Yeah. So most of the NGOs, healthcare NGOs that I've worked in, all of the roles have been voluntary. Currently at our organization, all of the people are working because of the sheer passion they have for this area. But after a point, we require that they're properly they have a proper stipend or a salary, at least for the work that they're putting in, as some acknowledgement. So that is where we're shifting currently. So we've started off in India, and we're currently regularly changing the structure. So what we are right now from what we started is quite different. So I'd say by the end of next year, I'm hoping that we have a structure wherein we have a bunch of honorary positions and a bunch of executive positions who are putting in the hard work and who are managing the execution. So those would be the people who would receive some compensation. So once that system is established, I'm looking forward to looking forward that it gets established by the end of this year, hopefully. And we've identified 6 countries where we have colleagues. So if we wanted to expand, we could have expanded very, rapidly, but it wouldn't have made sense that when so many people are involved and we keep changing the structure. Yeah. So there are 2 things which will be very important. So the website, what we are planning. So the web application would also give access to a lot of material that we've created to people who are starting off in their countries. So it becomes extremely easy. You can probably start off in a country in a month. And the countries that we've looked at, our main focus would still remain at the low and middle income countries. And we try to take up 1 to 2 countries in each of the 6 WHO regions, so that we get ideas on what are the different challenges that we're facing in different regions. And once we'll then take our time, we'll take a year or two with those 1-2 countries, we'll not expand more than that. And we'll see how it's working in those countries. And after that, we'll properly expand in the entire region. And I think that should just take 6 months or so. So how you might have heard the bamboo tree, the Chinese bamboo tree. It takes a long while to get up the ground, but once it's up, things happen quickly.
Yeah,
and
I have a feeling that's the way it's going to be with you. Yeah, I have a feeling that's definitely going to be the way. Can you share what some of those countries are?
Yeah, sure. So we're looking at Colombia. Then in Africa, a lot of people are interested. So we, because of worked in with a lot of people across the world, I have colleagues. So we've people from Egypt, Cameroon, DRC, Nigeria. Yeah, all of these countries, we have our colleagues who are ready to take it up whenever we're ready.
Okay.
So that's in Africa. In Europe, we have Bosnia and Herzegovina. Then that's one country where we're looking to go. And it's also possible to go in a few of the developed countries, if we may, like UK or the United States. But the models there would be completely different. So again, that would be how we.
In fact, the models will be probably somewhat different everywhere you go, just because of what you explained about what happened, why India is, why that thing happened, the genetics and the culture and everything. And largely, what their habits are and their eating and everything, what they consume on a regular basis and lifestyles that that exist. When you get to Nigeria or anywhere in Africa, we need to talk. Okay, so when you're ready for that, we definitely need to talk.
So just a quick thing. So we currently have one of our partners working in Kenya for a project on cardiovascular screening. So I think I'm saying next year, but it might just be sooner than, it might just be mid of this year that we start, because there's so much need that we can see in Africa, and so many people out there who are really pumped up to take things up. So I think I hope we can start sooner than 1 year, but a lot of places we've already have small aspects of our work beginning. So
very cool. Excellent. Well, I'm gonna have you stay on for a minute afterwards so I can share something with you. But as we exit out, tell us, remind us again what types of people that you need to meet to kind of help you move forward now that we know where you're headed. You can tell us.
For sure. Thank you so much. So we're looking at people, probably people interested in healthcare in different countries who are interested to take this up in their countries, because we're planning to expand soon within the next year. So if you're interested, they can contact us and they can be in the loop of what's happening. So it's easier for them to set things up there. So I think that'll be. Is there a
newsletter or anything where they might be able to sign up to get updates on how you all are moving along?
We're working on that, so that should be up soon. Hopefully, we're still working on the website aspect, but we'll, if as soon as it's ready, I'll send across a link.
So anybody watching that is looking at this and thinking this might fit within the structure of your own NGO, because I could see the types of people that you're partnering with already in India. I could see those types of people also being in our, our viewership. And I could see lots of NGOs that tap into the healthcare, and maybe it's not just healthcare, maybe they're tap into the demographic that you pretty much are aiming for. And so being able to offer this as part of a wellness or something like that, being able to establish it within their framework and within their location, I could see being pretty useful. So, if you're watching this, definitely, if, come to me if you can, we'll put his LinkedIn profile, we'll put whatever information and links that he provides us so that you can get a hold of him. But all else fails, get to me, we'll get it to him, and he can keep a running list of who all wants to be apprised of anything that's coming up. So anybody else that you're looking for? Any other types?
So we're also looking at people in tech. because currently what we're working on is huge health data, and there are a lot of AI algorithms which can be trained out of it. So our tech team is working in that area, but we still require a lot of help in the tech aspects of things. So right from website development, web application development for the telemedicine aspect, to AI, machine learning, and blockchain probably for these areas. So people in tech who are interested in digital health probably. So that would be, I think, the second place where we require help going ahead.
Okay, excellent. How can I ask you how you've been funded to this point? Are you making use of any grants? World Health Organization, any other large NGOs that are helping you out?
So up till now, we've just been working on local collaborations and nations. So we're still looking forward to have grants for our projects so that we can take things ahead. We haven't received any yet. Most of our funding has come from local collaboration, so it's still a sizable amount. But yeah, we're still looking for grants in the healthcare area to progress with it.
Yeah, fantastic. Well, this is great. Stay with me for a minute, Priyansh, and I'll say goodbye to everybody else. If you're watching this on YouTube, go to www.frontrunnersinnovate.com, where you'll see this interview embedded, and then all the other information that Priyansh is going to provide to us. So you'll have links, you'll have, maybe some pictures. We'll ask him for some pictures. If he's got a speaking bio, that would be great, because I know some of you would like to probably get him as a speaker because he's very good. So thank you, everybody. I'm going to say goodbye to you. Bye-bye. Till next time. Happy front running.